been waiting to see what India's vaccine rollout plan is, and some extent of clarity has emerged today after an all-party meet that the Prime Minister Narendra Modi conducted. At the end of the meet, Prime Minister Modi said that the vaccine, as per scientists, should be ready over the next few weeks. We're also learning that there is an elaborate rollout plan in the works, which begins by prioritizing your health workers, followed by your frontline workers. Let's first listen in to what PM Modi said at the end of that all-party meet.
एक्सपर्ट्स ये मानकर चल रहे हैं कि अब कोरोना की वैक्सीन के लिए बहुत ज्यादा इंतजार नहीं करना पड़ेगा। माना जा रहा है कि अगले कुछ हफ्तों में कोरोना की वैक्सीन तैयार हो जाएगी। जैसे ही वैज्ञानिकों की हरी झंडी मिलेगी, भारत में टीकाकरण अभियान शुरू कर दिया जाएगा। टीकाकरण के पहले चरण में किसे वैक्सीन लगेगी, इसे लेकर भी केंद्र सरकार राज्य सरकारों से मिले सुझावों के आधार पर काम कर रही है। इसमें प्राथमिकता कोरोना के मरीजों के इलाज में जुटे हेल्थ केयर वर्कर्स, फ्रंटलाइन वर्कर्स और जो पहले से गंभीर बीमारियों से जूझ रहे हैं, वैसे बुजुर्ग लोगों को दी जाएगी। साथियों, वैक्सीन के डिस्ट्रीब्यूशन को लेकर भी केंद्र और राज्य सरकार की टीमें मिलकर के काम कर रही हैं। भारत के पास वैक्सीन डिस्ट्रीब्यूशन एक्सपर्टाइज और कैपेसिटी भी है। दुनिया के अन्य देशों के मुकाबले इस क्षेत्र में हम बहुत बेहतर हैं।
All right, to speak now on India's vaccination plan, I'm joined by Anant Bhan, Global Health and Policy Expert. Anant, great to have you on the show again. Just your take on the information we have so far, which is essentially, possibly, India's plan is to start by vaccinating 1 crore health workers, followed by frontline workers, and then above the age of 50, and then those with comorbidities, etc. What's striking is that it's a very different approach as compared to, say, the United Kingdom, which puts the elderly at the front and center of their vaccination program.
Thank you, Tamanna. Thank you for having me. Yes, absolutely. We are hearing interesting details about India's proposed vaccination program. As we all know, whenever a vaccine is made available for mass usage, there's always going to be a limited number of doses which are available, and hence every country will have to take that prioritization decision. Now, each country is going to use specific frameworks. It might be an age-based framework, which might be that, those who are elderly, most at risk age-wise are the ones who get the vaccine first, and the UK primarily seems to be going in that direction because they have a lot of old age care homes where they've seen a lot of serious disease and mortality, and they probably want to ensure that they protect that population initially and the health workers who directly work with them. In India, we've gone with a slightly different strategy, which focuses on those who are critical to our health system response. And these are health workers, obviously, because, in the absence of health workers or with health workers being ill due to COVID-19, you will not be able to run your health facilities effectively. So we want to, obviously, we as a decision, then we have gone ahead with wanting to prioritize health workers and then frontline workers, so people who are critical to our response, and then we go with an age-based criteria. So I think it's sort of a mix of approach, not purely based on risk, but also on what elements of our human resources are most critical in our COVID-19 response. I think it's important here to highlight that, whichever direction we take needs to be based on a clear rationale and publicly communicated. We've seen that happen with the US, for example, where there is a National Academies of Sciences report, which very clearly lays out in quite a bit of detail around the various permutations and combinations they looked at before coming up with a framework in terms of where they think phase 1 of the vaccination should focus, and phase 2, phase 3, phase 4, and who should be the groups of individuals in each of those phases. So I think it'll be good for the government to come out with some level of detail around what was the background thinking around this and on what evidence was it based. so that it's transparently available for everyone, and all of us have access to that information.
Do you see this happening in a very central way or through a center and state collaboration? I thought it was particularly interesting that this very, very crucial conversation has happened in an all-party meeting, not just a PM-CM meeting, but an all-party meeting. There seems to be an effort to bring everyone on board because there will be some sticky issues even as far as subsidizing these vaccines are concerned going forward, isn't it?
Absolutely. And I think we have to all remember that health is primarily a state subject in India, which means that a lot of decision making around health primarily happens again at the state level. The programs, the layout, the staffing, the infrastructure, etc., almost entirely often is with the state. So unless you get the states on board with any large-scale plans for immunization for COVID-19, it's not going to succeed. So I think it's good that that is being well thought through, and you are trying to make that outreach to all the states to involve them in that process. Unless we have some kind of a jugalbandi between the center and the state, this initiative is not going to succeed. And it's important for both the center and state to sort out the logistics issues, the transport issues, the human resource issues. Where exactly will the delivery of the vaccine happen, whether it through outreach, whether at facilities, and I guess the thorny issue around cost, who's going to pay for the vaccine. In my opinion, it should be free for everyone in terms of actually accessing the vaccine as a recipient, but then someone has to pay for it, and maybe it will be a combination of the center and the state, or purely the center. I think that's going to be one major issue for both the center and states to sort out.
What do you see happening in terms of a private market or private availability of vaccines? Because, we have to admit that healthcare in India is run to a great extent by private enterprise as well. There is a government infrastructure in place, but the efficiencies and the trust still lies with the private sector as far as healthcare is concerned. And there are a lot of people who are going to go to their local medical facility for that kind of outreach. Do you see a situation where all of those vaccine rollout is going to be government controlled initially, or do you see down the few months down the line there will be a private market for vaccines of various varieties as well?
Yeah, so I think the main challenge here we have to remember is that we're going to have limited number of doses, and that's going to be the situation through, I think, most of next year and even probably running into 22. Depending on whichever vaccine we finally end up choosing for India, it's going to be likely that we will have to work with that limited inventory of doses. And if there is a limited inventory, then it has to be a choice, and the choice is right now here a public health response to a pandemic, which I think is pretty much one of the key important governance issues which the government has to take a lead on. And hence it's important, I think, at least till we have enough supply for the public system, that we probably route our vaccination plans through the public health system. Now, that doesn't mean that the private system needs to be excluded. In fact, you can perhaps work with the private system, because in many parts of India, you might not have effective coverage of the government system, or it might not be functional optimally. So perhaps you could partner with the private healthcare system in terms of delivery. But that doesn't mean that automatically that vaccine should be available for purchase prior to actually having effective coverage. Because the concern then it will be that there might be subjectivity, there will be an inequity. If I have access to finances, then I'll be able to jump through the queue and go to a private practitioner and get the vaccine, and other people will keep waiting because they're not in the priority list. And it might just be the case that they are more vulnerable than I am, but just the fact that I am more financially well off places me ahead of them in the queue. And I don't think that kind of financial inequity should play a role in being able to access a vaccine at time of a pandemic.
But it's a real concern, isn't it, Anant, that that's exactly what will happen?
It is certainly a concern, and I think that is certainly something also that the government has to respond to. One of the things you want is trust in the vaccination enterprise, and the feeling that people should have that this is not a subjective matter, that there is a certain level of objectivity, and there's going to be fairness in the way distribution decisions are taken. If we lose that, or if there are doubts about that, that might actually impact the adherence to requests for vaccination, the way we are able to reach optimal coverage, etc. The trust in the vaccination enterprise is a crucial element of our public health efforts. If we don't get people interested in coming forward to get vaccinated, we will never get to that point where it would dent, the COVID-19 onslaught. So it's going to be extremely important to ensure that people are comfortable, are in sync, and trust the government response, and believe that they will. These kind of factors, financial inequity, are not going to be the reasons why people will be excluded from vaccination plans.
Tell me what you make of the rollout platform that will be used. There's a lot of talk about using, the Digi Health infrastructure that was announced on 15th August, but that's just an announcement so far. Then there is some talk that we will be using the election system and infrastructure by maybe electoral rolls being the basis or Aadhaar cards. How will we go about ensuring that there is a database of those who have been vaccinated? Because remember, all of these are 2-dose vaccines where people have to get their second dose after a certain number of days.
Yeah, it's going to be a complex exercise. I mean, India's existing universal immunization program is certainly among the world's largest immunization programs, and there is a lot of history and experience there which needs to be leveraged. But also the COVID-19 vaccination program is also going to be a more complex program, because you're vaccinating people across the age groups, unlike the usual immunization program, which focuses on pregnant women and children. Also, you need to figure out a way to get to these different age groups. Will they be coming to facilities? Will you be going to their homes, door to door, etc.? And you will need to do a mix of things. You need innovations. You also need to obviously have databases. But it's also important to remember that we don't want to be excluding people on the basis of, say, identity documents, etc. For the one singular reason that this is a public health crisis. It's an infectious disease. And the more people we immunize, the better chances we have of being able to prevent further spread of infection. So I think the coverage is going to be our most important criteria, especially for those who might be vulnerable. And by covering more and more people and getting them immune to infection, we will actually be ensuring that we are better protected as a country.
So to understand this clearly, because the health secretary earlier this week said that there is no real plan to immunize everyone in India. Not everyone needs to be immunized for herd immunity to kick in, right? The whole population cannot actually be vaccinated in any decent period of time. It will really take a lot of stock and a lot of time. So do you think that the priority will not really be to vaccinate everyone, but to get a significant population of the country vaccinated?
Yeah, well, herd immunity depends on the infectiousness of the agent that we are dealing with. And in the case of COVID-19, one of the challenges we have is that this is a novel virus, and we don't know perhaps enough about the virus. We're still learning. So, anything about how long immunity will last with either, just getting infected or actually getting vaccinated. We don't know the durability of that immunity. We don't know, what is the right mix. Is there a perfect percentage that we should be aiming for? We don't know that those, because we have, again, we're still studying the virus. We're still understanding immunology and pathology related to the virus. So I think we should be aiming to try to maximize our coverage, because we don't have a magic number in mind, and we don't have that prior information already. And also we have to remember that even with our existing immunization programs, we haven't still reached optimal coverage in many parts of the country. So if that is true of vaccines that we've had for sometimes literally decades, then we have to try to ensure that for a new vaccine, which needs to be given to a larger age range, that we try to, again, maximize our outreach, so that we don't reach a situation where our efforts fall short.
Absolutely. Let's, get realistic about the timeline. This is going to take at least a year, if not years, to get a significant part of the population vaccinated. We're still in very early days where we're trying to figure out when the vaccine will be available in India, and we're focusing on an indigenous vaccine here. Thank you so much, Anant Bhan, for speaking with us today.
Thank you for having me.